The Government of Uganda, through the Ministry of Health, has confirmed that there is currently no confirmed case of Ebola in the country. Speaking during a press briefing at the Uganda Media Centre, the Permanent Secretary of the Ministry of Health, Dr. Diana Atwine, revealed that the individual who had earlier tested positive for Ebola later tested negative after further assessment and testing.
Uganda has not registered any positive case apart from the imported two that we told you about on 15th and also 16th. And we have not registered any other. All our contacts are under observation and none has so far tested positive. As is now, because we don't right now, actually even the one who had Ebola tested negative. As I talk now, we don't have Ebola in the country. The one who's been taking care is improving and has tested negative. And soon, once she gains strength, we'll be able to discharge her.
Dr. Atwine noted that although Uganda has no reported cases at the moment, government has intensified preventive measures, especially in the high-risk districts including Bundibujo, Kasese, Bunyangabo, and other districts neighboring the Democratic Republic of Congo.
And for emphasis, allow me to read these districts. These include Kasese, Ntoroko, Bundibujo, Kabarore, Bunyangabo, Chisoro, Chikube, Kamwenje, Chegegwa, Hoima, Bulisa, Wakiso, Kampala, Chiliandongo, Lamo, Isingiro, Arua, Nebi, Pakwach, Zombo, Moyo, Koboko, Maracha, Yumbe, Obongi, Madiokol, and Kanungu. Some of these are categorized as very high risk, especially the ones that are directly in connection with DRC.
Key interventions announced by the ministry include increased public awareness and sensitization campaigns, enhanced screening and treatment systems, establishment of additional testing centers to reduce turnaround time, and temporary suspension of cultural celebrations in high-risk areas.
We are temporarily suspending all cultural celebrations, commemorations that attract big numbers of participants along DRC Uganda border. And this particular one, we know that the of Dingia will be celebrating their anniversary, their commemorations, and we are advising that they postpone this until we are out of this. As you know, Bundibujo is right next to DRC, and therefore that will cause a lot of mass movement. So we are advising that we postpone that function.
Government has also announced the temporary suspension of passenger service vehicles in affected areas, with only goods and essential services allowed to continue operating. Authorities are further strengthening death reporting systems, tightening border security, enforcing standard operating procedures in schools and markets, and discouraging the use of porous border points. In addition, all flights from the Democratic Republic of Congo are expected to be suspended within 48 hours as part of efforts to prevent possible cross-border transmission. Despite the heightened alert, Dr. Atwine emphasized that schools will reopen as scheduled with strict enforcement of SOPs to ensure the safety of learners and staff.
We know that schools are going to open, and we shall open on time. School opening will not postpone, but we advise the head teachers and the Ministry of Education to ensure that all the SOPs we have issued are followed to the dot, because we know schools are crowded and they bring together many people across the country.
She added that with support from the National Task Force, including the Uganda Police Force, Ministry of Internal Affairs, the media, Uganda People's Defence Forces, and health teams across the country, government remains committed to protecting all Ugandans from any Ebola threat. Nagujja Serena for NSTV.